I talk to parents very frequently because there is something about having a baby which seems to attract helpful advice from family, friends, even little old men will stop you in the shopping centre and tell you how to attach the baby successfully to the breast. Most of that advice seems to come in two major themes. You've got the group of people who think your baby should be controlled, has to go into a routine. Be careful not to spoil him, and you are the boss. And then there's the other group of people who suggest that your baby, and this is called attachment parenting, your baby needs to be cuddled and breastfed constantly and demand fed, of course, and he's the boss. Now, why there are these two models actually goes down to history. The old model was the idea that babies were born in original sin and they were essentially quite evil and they needed control. But then in the 50s and 60s, people started to realize, especially psychoanalysts and psychologists, that this actually wasn't the case. And so they started to look at babies scientifically. And that's the point. We've had a lot of scientists looking at how to optimally look after babies. And it's interesting, no matter which branch of science they come from, they seem to be saying the same thing. The anthropologists started it. They said the design of babies started about 4 million years ago when we became ground-dwelling apes and started to walk around on our hind legs. You see, when you throw the whole weight of the body on the hip joints, you have to build big buttresses of bone on the inside of your pelvis to take the weight of the whole body on 2 legs instead of 4, and that narrows the birth canal. We also became walkers, so we rotated our pelvis posteriorly, so our bum sticks out. So when we walk, we glide. But then we have a birth canal that's narrowed side to side and is a flattened S-bend. Now, it didn't matter 4 million years ago because the brain size of the little baby was very small, about the size of a chicken's egg. Then along comes Homo sapiens, that's you and me, and suddenly nature's got a problem. How do I get a big brain baby? Because that was the difference about being Homo sapiens. They have big brains. How do you get a big brain baby out through this narrow athletic pelvis? And we started to lose mothers and babies, even when babies were presenting normally, by the head. And so obviously evolution is going to correct for that really quickly. And the way nature corrected, the way evolution selected it, was we have our babies earlier in pregnancy. So quadrupeds can have full-term babies. They can have miniature adults. They can keep their baby inside until they've got 80% of their brain formed. Our babies come out much earlier in pregnancy when they've only got 25% of their brain. So the take-home sentence is, you take home a preemie. You don't take home a full-term baby. So where does your common sense tell you about what to do with that baby? Of course, you cuddle him closely. You provide him with a womb-like environment. And in fact, biologists call babies an exteriogestate fetus. And if you look at human milk, it's milk that is given to a baby almost continuously. It has very low protein. It's not a 4-hourly milk, never was. 4-hourly feeding was invented by German anatomists who looked at the size of the baby's stomach and said this needs to be filled and emptied about 6 times a day to give the baby his 24-hour caloric intake. Didn't check with the babies, because if you look at babies, they'll feed on and off throughout the day, throughout the night, if they are close. And that's the point. Demand feeding is, of course, the only way to go. So the question is, what do you do when your baby cries? It's obvious. The first thing is you feed him. Oh, I fed him an hour ago. Feed him again. We have a continuous contact milk. He may still be hungry. And in fact, ultrasound studies show that when a baby's stomach empties of breast milk, it takes only 32 minutes to do that. So overfeeding your baby is really, really hard. And in fact, I wouldn't even think about that until you get down the track to 4 to 6 months of age. And then you should be sorting out whether your baby is hungry or whether he just needs a cuddle. If he's not hungry and he's still upset, how do you deal with him? Well, he's a preemie. Put him back in the womb. So you replicate life in the womb. What's it like in the womb? Well, First thing, you hold them close. Babies are very snug when they're in the womb. Rounded back, contained limbs. Babies love to be swaddled. And when you swaddle a baby, make sure the swaddling is only the upper limbs. Don't swaddle his legs straight out, because that can affect the development of his hip. Babies should have their hips flexed and their knees slightly abducted or splayed, as we say. The second thing about being in the womb is it's really noisy. Everyone's tiptoeing around the baby. Completely unnecessary. The noise level inside the womb is the same as an underground train entering a station. It's 85 decibels in there. Why are we tiptoeing? And of course, the main noise that a baby hears within the womb, the sound of the heartbeat. That's why we hold babies on the left. You look at all the artworks, babies on the left. Why we pat babies at maternal heart rate, lullabies, maternal heart rate. Maybe that's where the word shh comes from. The sound of the blood flow going through the uterine bed. And they like conversation. Put the radio on. They've been listening to Dad talking at them through the abdomen for 9 months. They don't want that to stop. So give them some background family sounds. The third thing about being in the womb is it tastes great. Babies are gulping amniotic fluid all the time they're in the womb, and the amniotic fluid tastes of what mum had about half an hour before. So by the time the baby is born, he is completely familiar with mother's dietary choices, and he wants that to continue. That's another beautiful thing about breastfeeding, because when you're breastfeeding, you should have the same diet as you have when you were pregnant. And you should have as many different kinds of high quality foods as you can get, so the baby gets a taste of it. Because we know that babies' taste preferences actually are put in place, wired into their brain in their first year and not beyond. So you have a limited amount of time to get your baby to like good food. And the fourth thing about being in the womb is it's really boring. There's nothing happening. On a particularly interesting day, they'll see the umbilical cord. Whoa! But most of the time they're just looking at the inside of the womb. So when they come out, suddenly it's all lights and magic and sisters and cousins and aunts and everybody's in their face. Some babies can cope, but most babies can't. And if you get into your face too much, and if you've got too many rellos, and grandma won't leave him alone and spends hours and hours just staring at her beautiful grandson, it can drive babies up the wall. And obviously it drives them up the wall towards the end of the day. That is why at 4 to 6 weeks, babies get the colic. That is, they start to scream and they start to draw their knees up, and they look like they're in terrible abdominal pain. We know they're not in pain. What they are is overwhelmed by all this visual input that they can't deal with, and they need to be calmed down. Take them into a dark and quiet room and feed them and pat them and feed them and pat them, and then wrap them snugly, put them in their cot and bore them to sleep. That's all you have to do. And you only have to keep this up until they're about 3 months of age. Isn't it strange? It's called 3-month colic, because at 3 months, 4 months, it tends to go away. And it goes away because the baby learns to shut off all that external stimulation, look away and ignore everyone in the room until he's feeling calm again. And that's how he deals with it. But he can't deal with it in that difficult window between 6 and 12 weeks. Now, why is it important that you know how to deal with your unsettled baby? It's because of what the neurobiologists tell us. Now, I mentioned earlier that babies have only got 25% of their brain formed. What the neurobiologists tell us is that that 25% is all of the brain cells. All 100 billion of them are sitting inside the skull. What the other 75% are the connections. Aha! How you connect your brain is, of course, genetically determined. That's your potential. But how you actually connect your brain, a lot depends on how you are parented, how you are loved and looked after and made feel secure in your first year. We have lots of information about that. And now we even have the imaging, because neurobiologists have looked at imaging of the baby's brain. The baby's brain is in 3 parts. All primate brains are in 3 parts. You've got the basic brain that looks after your basic functioning, your appetite and your blood pressure, all that sort of stuff. The next part is called the midbrain or the limbic system, and that scans for threat. And it has big subconscious emotions: fear, rage, separation anxiety, love, joy. And on top of that, we have the neocortex or the frontal lobes. They're big in primates. And they're where our intelligence and our personality and our ability to plan and use our experience, that's where it comes from. Now, here's the crunch. Babies have no neocortex online at all. They're just limbic system babies. So they've got fear, rage, separation anxiety, joy, love. Isn't that just like a baby? Now, over the first year, they wire up the nearest part of their neocortex, and the nearest part is called the prefrontal gyrus, and the function of the prefrontal gyrus is the management of the emotions from the midbrain. And babies learn from their parents and their carers how to deal with those explosions of stress, because when the midbrain perceives a threat, it puts in place a stress reaction. They pour out cortisol, a hormone that makes everyone say, whatever you're doing, stop and deal with this problem and deal with it now, and everything else goes out of your mind. You know, the freeze, flight or fright reaction. Now, when babies cry and they're in distress, and you pick them up and they're full of cortisol and you cuddle them and calm them down, their cortisol comes into a comfortable zone and the baby says, that's the way I'm meant to feel, and he wires up his prefrontal cortex accordingly. And it's all done and dusted by the age of 1 year. So if he's got lots of cuddles and lots of security, he wires up lots of receptors which mop up cortisol in his prefrontal gyrus. So it's all in his hardware. So by the end of the first year, babies have a feeling of security or they don't. They have a feeling of whether they're valued or they don't. And so all of this basic stuff which babies need to wire up happens in the first year. And on top of that comes all of the other functions, the mathematics and the social ability to deal with social groups and the executive functions, all that stuff. It's all based on what we called emotional intelligence, and that's in the baby's first year. I think I'll leave it at that. If there are any questions, I'd be happy to take them. Well, the first thing that occurs to me is she has learned something, and she's only 4 months of age. It's interesting. I mentioned we have no neocortex online. Now, part of our neocortex is our working memory. And so babies have little or no working memory under 6 months of age. So whether she's learned something or she's just reacting to something is very contentious. Now, silent reflux is a big subject. Some would say that you can't diagnose silent reflux under 3 months of age, because actually silent reflux doesn't occur. And if you look for it, you won't find reflux disease. You see, reflux, all babies reflux. They've done studies where they've looked at the esophagus of a baby, that's the gullet, and they put a pH probe which measures acidity to measure gastric juice halfway down the gullet, and they've found that the average baby on an average day does 20 episodes of reflux up into the gullet every day. That's average, so some do more, some do less. So silent reflux per se is a normal process. Now, there is a thing called reflux disease where babies suffer from this. Now, those babies tend to vomit a lot, they tend to fight the breast, they tend not to put on weight well, and they even vomit blood. Now, if the baby has those things, I would be prepared to diagnose reflux. Silent reflux is a very iffy diagnosis, and I wonder whether or not the baby isn't just tremendously unsettled. One of a twin, maybe too much going on, different personalities of baby. And what I would suggest, go on my website and look at the FAQs. There's one called Bore Your Baby to Sleep. have a look at that and have a go and see whether or not that helps. The only other way you would know whether the baby is one of those rare babies who's got silent reflux is if you give them Zantac or you give them Losec, and they get remarkably better, literally within 48 hours, 3 days. And there are not many babies like that. You know, co-sleeping is a natural part of being a human, especially a natural part of a human who's breastfeeding. So, I mean, the Americans are trying to ban co-bedding. And the reason they're trying to ban it is and it's the same in Australia, about half the babies who die of sudden infant death syndrome are in bed with someone. Now that is not good. That is really bad figures. But the problem is not the co-bedding per se. It is the risk factors associated with co-bedding. So with SIDS. So that if you are going to co-bed, you just have to make absolutely sure that there are no risk factors. And those risk factors are no booze, no drugs, no cigarettes, the biggest bed you can get. And it shouldn't be too soft, and there shouldn't be any pillows with the baby. Certainly no water beds. Make sure that the babies don't overheat. So there shouldn't be any animals, there shouldn't be any toddlers. It should be a conventional bed. Disasters happen on sofas, and that's where a lot of the cot death disasters occur, on cots with people who are often not the mum. So that's really important. The other thing is that if the baby is formula fed, it seems to be a different situation, and formula fed babies and co-bedding seem to have an extra risk factor which may not be worth taking. The other thing about co-bedding, if the baby's an ex-prem, or if the baby is a small baby, they often don't have the ability to move their neck appropriately if they get into a wrong position. So they are also at increased risk. So you have to be really careful with them. But yes, you should do it, but you just have to recognize that the margin for error is much reduced when the baby's in bed with you. Why there is any debate about controlled crying, I do not know, but I think it's because of the old-fashioned view that babies need to be put in a routine and mum needs to be the boss. We know controlled crying actually does work. Now, if you have a fairly new baby in the first few months and he's crying and crying and crying, you walk away and you shut the door, soon your baby will stop crying. But if you go into that room and you look at him, he is lying there with his eyes wide open and he thinks his mother has abandoned him. No working memory. So if you're not there, all they can think is you've gone and you've never been there. So they are abandoned. And we're wiring up our brain, we're wiring up our security. So the last thing you should indicate to your baby is, I love you during the day, but at night when it's dark and scary, you're on your own, baby. I don't think that's a very good message. It should never be used, ever, in the first 6 months, because it doesn't work, because the baby has no ability to learn. And anyway, you get them asleep on one day, 3 days later, it's all out of the window and you've got to start again. Between 6 and 12 months, it is not advisable. But you can start pushing babies towards sleeping in a more appropriate way, but you push them in a no-cry way. That is, you do things step by baby step, moving in the direction you want them to go. For instance, night feeds. If you'd prefer your baby to night feed less from 6 months onwards, the first thing you do is make sure he doesn't fall asleep on the breast. So he goes down drowsy but awake. The second thing is you make day feeds and night feeds completely different. Day feeds are lively and you're looking in his face and the music's on. Night feeds, very boring, very quiet. But lastly, when you go to your baby at night, you go to him straight away as soon as he cries. But you pick him up straight away, but you might change his nappy or walk around with him. Then you feed him. So you create a delay between him crying and you feeding him. And he doesn't get this reflex I cry, she feeds, I cry, she feeds, which can end up as something of a habit as they move beyond 6 months. You can curtail that by creating space, and that's the way to do it. Tiny steps, step by step. Babies need dads. Now, they certainly need mums primarily in the first few months, and dads often feel a bit lonely because mum and baby are sitting in that little engrossed little group, and dad feels a little bit on the outer. But it's really important that babies and young children get fathering, because fathers actually behave in a different way to the mother of the baby. For instance, the mother of the baby tends to keep the babies close, keep the babies close. Dads just sees how far they'll crawl before he brings them back. Dads will take their babies and throw them in the air and catch them. They're more physical in the way they look after their babies. And babies need that to see that there's two different sides to it all. Also, we know that when dads cuddle their babies, their newborn babies, the more they cuddle them, the more they get the same warm, loving hormones that the mothers get too when they breastfeed and they hold their babies. One in particular is called oxytocin. This is the hormone. It's a hormone that causes your uterus to contract and your breasts to expel milk, but it's also a neurotransmitter. And when it's secreted into your brain, it is the hormone of calm and connectedness. And mothers, breastfeeding mothers especially, have that in spades, as do babies. Fathers can get an increase in oxytocin also by looking after their babies, cuddling them close, putting them skin to skin, changing their nappy, getting involved in all the other things other than breastfeeding. We're primate mammals. We should breastfeed our babies until there is a mutual weaning. That is, both parties don't want any more part of it. And often babies will wean themselves as time goes on. But in fact, if you look at us as a species, we're probably designed to breastfeed our babies for about 3 years. Now, I know that sounds a lot, but the reason is, if you look in the developing world, babies tend to be breastfed for 3 years, during which time mum doesn't have any periods because she's breastfeeding and breastfeeding. Then she weans the baby completely off the breast, then she has her periods, then she gets pregnant again. And so babies tend to be spaced out in the developing world at about 4 years. And anthropologists tell us that when you space babies out to 1 every 4 years, if you look at those families 100 years' time, they've got more members in them, the ones who've got 1 every 6 years and 1 every 2 years, because 1 every 2 years they tend to lose more babies from lack of food and lack of care. So 1 every 4 years seems to be the breastfeeding, the reproductive norm for humans. And so breastfeeding, feed the babies as long as you like. We know babies tend to get onto solids about 4 to 6 months, but there's wonderful things in your breast milk which go on for years. Well, it's interesting, dummies. The American Academy of Pediatrics actually recommends dummy sucking, and it does so because in their population it actually lowers the incidence of sudden infant death syndrome to have a dummy in the mouth. But we wouldn't go as far as that, but it's clearly that it does no harm. And certainly in that difficult period between 6 and 12 weeks, when you get the baby tends to be a little bit extra agitated, having a dummy can calm some babies down. Now, what do you do with it? Well, it's a good idea beyond 3 months to see whether the baby can do without it. And the reason I say that is as they move towards 6 months, they tend to want to start putting things in their mouth, and they put objects and they experience the world using the sensation of what it's like, what it tastes like, what it feels like in their mouth. And if they've got a plug in the way, that interferes with that. So it's a good idea for them not to have a dummy in at 6 months, if you can arrange it. If, of course, they love it, it's their business. And really, we're after keeping our babies calm. And that is the primary and most important thing. Even though they might not look as you want them to look if they've got a dummy as an older child, see whether or not it keeps them calm. And if it does, talk to them about it, because there's no reason why they shouldn't do it. Most parents, when they have babies, have got inside of them the ability to look after the baby. But in our modern day, we think somebody else has got the information, in particular, Dr. Google. So we've got all this information all around us, and we're not listening to our inner voice. What I do when I talk about reassurology is just let parents know to listen to their inner voice. You see, the driving force of babies' development, how their brain develops, how their personality and how their neural connections are made in their brain, is driven by a process we call attunement. And attunement is when the mum, in particular in the first few months, but mum and dad, they observe their baby and they see what their particular baby needs. They don't check with a baby book and they don't go online to find out what to do when their baby. They just empty their head and they watch their baby and they try things out. Now, trial and error and common sense are the two main tools that new parents can use, but so often we think that we really need some professional advice. No, trial and error and try it out, and that's the point. Your baby will soon tell you whether it's working or whether it doesn't, and within a few weeks, months at the outside, you, the mum and the dad, become global experts on their babies purely by what they've tried and what works, and very soon they're completely anticipating their baby's needs and nobody can tell them how to look after their baby. That's what reassurology is all about.